concept of family care clinics is really based in tenets of interprofessional primary care. You have independent health practitioners, so you either have physicians or you have nurse practitioners, and in both cases they actually look after a roster of patients, so they look after a group of patients. And one of the principles in primary care is continuity of care. And the data is clear that those longer standing relationships really do improve not only the patient and the provider experience, but it improves the quality of care that patients get. This team was put together shortly after the Slave Lake wildfire. So we really needed a significant focus on addiction and mental health as well. So a lot of this modeling, when it was developed with our Tri-Council, so it was developed with our local leaders. So our elected leaders, our Indigenous leaders, and one of their requests was absolutely from the beginning, we need to make sure we've got a focus on Indigenous health, but also we needed to focus on addiction and mental health, and we needed to focus on after hours work.
I started off graduate, I did the AMA locum program, and I always joked and said the community that I went to needed to have three things. It needed to be able to do deliveries, needed to have obstetrics, and it had to have a Tim Hortons. And then when I came to Slave Lake, it had all those three things, but then on top of that, it had the FCC, which I thought was just an amazing model. We're paid via salary, so we're paid a sessional fee, so an hourly fee. So for me, that was huge, because I don't have to see 6 or 8 people an hour in order to make ends meet. You know, I get to see 4 people an hour, sometimes a bit more if I'm seeing walk-ins or something like that, but I can spend that extra bit of time. I can go and do that preventative care, ask them about, you know, hey, what's going on with your life? If there's anything that we haven't talked about that you want to talk about, you know, they come in for a prescription refill, and it's not just, okay, here you go, get out and think, oh, sweet, quick visit, extra bucks. No, I take that time and say, okay, well, look, we got 15 minutes. Like, I've done your prescription refill. Like, when was the last time you went and did blood work? You know, do you smoke? Do you drink? Is there anything you're concerned about? Is there, you know, what's going on with your life that might be affecting your health? So you can take that extra bit of time and actually do a good job. So I take that extra time and I make sure I do a good job and do that holistic care that for me is important to me.